Hi, I'm Meyer. I'm a pulmonologist practicing in the Sacramento area, and I've seen and observed medical practice for more than 30 years. A big concern in this country is the cost of health care, and much of this is patient-driven, hospital-driven, and family-driven. Emergency rooms are quite expensive compared to office calls, but still patients go to the emergency room because they have no concept of the cost. And so they go there for a small, sorry. Just continue.
Yeah.
So they go to the emergency room for minor problems. In fact, yesterday I had a patient come to me for a rather ordinary problem, but her family got concerned 2 days earlier and said she should go to the emergency room. They were worried about her coughing. Well, she had nothing significant and didn't need any more, but the hospital bill was rather exorbitant. The bill that I see right here in front of me that she brought in, the basic emergency room charge is $1,500, where the office charge is about $100. Electrocardiogram charge was $465, where Medicare pays me $18 for the EKG. Chest X-ray was $755, where health insurance pays me $36 for the same chest X-ray. Blood count was $240, and Medicare and insurance companies paid me $28, which shows you that in many of these cases it's 10 to 20 times as expensive to go to the hospital. And that's why all these exorbitant charges add up the hospital bill. And she pointed out in addition that the ambulance ride to the hospital was $1,500. And the charge for an automobile coming to my office would be like $1 or $2 for the mileage. So it's rather significant different, and the patient says, well, I have insurance, so why shouldn't I? Meanwhile, healthcare costs are increasing rather dramatically. Patients have no responsibility for the costs. And the only answer is that there should be a prorated charge on deductible and co-insurance, co-payments on every item in healthcare. This was dramatically brought home to me when I recently had a Medicare patient, Medicare of the 1960 vintage, when there was 20% co-payment for outpatient medicine and maybe $1,000 for inpatient care. And she went to the emergency room with chest pain and a little shortness of breath, and she got the cardiac routine. I have a patient that works in the emergency room, and whenever you say heart, it's ching ching, and it's $9,000 before they get all the fancy tests done. Well, she had her usual treatment, the X-ray and EKG, some treatment in the vein, and she passed a lot of her urine and felt much better. And about 2 hours later, they said, well, it's time to go to X-ray for some more testing. She says, wait a minute, I'm paying 20%. Where's my bill right now? And they checked it. It was $3,000, and she's 1/3 of the way to the $9,000. And she says, I feel pretty good right now, so I think I'm going to go home. I have 20%, so I already owe you $600, and I'll forego that and go to the doctor in the morning and see my regular doctor. She was doing quite well when I saw her the next day. But that was the old Medicare. We had 20% co-payment. Every patient was concerned about keeping the charges down. Now people have all these health maintenance organizations and Medigap insurance, and there's no realization of the real cost of health care. And so they go willy-nilly and go to the emergency room, and it's been estimated that there's a huge increase. Let's say the 20% co-payment, and the average emergency municipal charge from our HMOs is $600. So the patient goes to the emergency room and they say, will that be cash or credit card? 20% of a basic charge of $600 is $120. And they would look at each other, and $120 just to get in and be seen. I think I'm not that sick. I think I'll go home and talk to my doctor tomorrow. And In our studies, we've seen that about 80 to 90% of people given that choice at the emergency room desk will probably go home and see the doctor the next day for $100, where the $600 will go up to $1,200, $1,500, and maybe several thousand. So the co-payment is the biggest disincentive to excessive healthcare costs. We've done some studies on this and ran it by some actuaries, and they said that the things that we were talking about would save about 40% of healthcare costs. And when you're talking about $3 trillion, a 40% saving will be well over $1 trillion just by a simple adjustment to the old-time Medicare and a co-payment. We discuss this every other week on our newsletter, medicaltuesday.net, which you can subscribe to and read all the previous issues on the website. Thank you, and we'll be with you shortly again.